Hello and welcome everyone. Good morning to everyone here in Alabama and good evening to everyone in Pakistan. On behalf of the Sparkman Center, I would like to thank everyone for joining us today for this presentation. This is titled as Climate Change, Environment and Health in Pakistan with Dr. Zafar Fatmi, part of our ongoing Global Health Seminar series this semester. This is the first of the seminars. And just to introduce myself first, my name is Tahiba Khan and I work as a program manager in the Sparkman Center. Before we get started today, I just have a few housekeeping things to go over. Firstly, this session is being recorded and will be posted on the Sparkman Center YouTube page in the following days. So just a heads up about that. And this session is in a webinar format. So please utilize the Q&A option on the bottom of your screen to ask any questions. We will have a 10-minute Q&A session at the end. You can put it in the box, right? And we can go over those at the end. But you can also type your questions in at any time during the webinar. Please also note that closed captions are available for this seminar and can be turned on by clicking the button on the bottom of your screen. And now to introduce our speaker for today, Professor Zafar Fatmi is public health academician, researcher, and practitioner with a terminal public health degree, FCPS in public health from Pakistan, and PhD from the University of Southampton, UK. He currently works as a professor and section head, Environmental-Occupational Health and Climate Change at the Department of Community Health Sciences at the Aga Khan University in Karachi, Pakistan. He serves as the director for Community Medicine Residency Program from 2007 to 2016. Dr. Fatmi directs research and academic activities of a group of public health faculty pertaining to environment, climate change, and human health, and that's what he's going to be talking about today. He also has more than 125 peer-reviewed publications that have authored multiple book chapters. And now, without further ado, I would like to transfer it over to Dr. Fatmi. So the floor is yours.
Thank you so much, Taiba, for elaborate introduction. And thank you, Cameron, also. And thank you all for joining this seminar. I hope this would be useful for you guys. I'm going to just share my slide. So I'm disabled to share any screen. Can you please help me out?
Try now. It should pop up now. There you go.
Okay, yeah, great.
Yep, perfect.
So I'll speak for about 35-40 minutes. And I'm going to talk about this climate change, environmental health. The outline I have here is actually, I'll talk about a little bit about the direct impacts, and you might be aware of the direct impacts like flood and heat waves, which is affected globally as well as Pakistan. So I'll give examples, recent examples of the direct impacts and what information we have on that. And they are, climate change actually affect the human health through common pathways, through the usual pathways of air pollution, through the, contamination of water, and it just exacerbates all of those processes. Some of those we know that water cycle and, air quality gets impacted due to climate change. And what information we have, I'm going to talk about that. So the three things, Lahore air quality is always coming in recent years as number one and number two all the time in the news. So I'll talk about that and some data from Karachi and what happened during the COVID also. So some examples from there too. Then water, again, what are the climate concerns? What are the general environmental health concerns for water contamination in Pakistan? And then how climate might be impacting. And at the end of the, my presentation, I'll discuss about a co-benefit study. So co-benefit is an area where, it's emerging and growing, where we're talking about if you're doing intervention for climate and it has, in addition, health benefits, it also reduces some of the risk factors which are actually impacting the health. So it has a co-benefit. So it is actually There's an argument about if you are investing in climate mitigation, you are actually helping the health as well as helping the environment. So upfront, I also want to say, if you look at Lancet Countdown and Health's paper, and it talks about how sparse information we have about climate change and health. As a robust studies, very few studies are available in LMICs. It is, few studies are available in high-income countries, but there are a lot of opinion papers, there are a lot of commentaries and opinion papers without actually any empirical information. So what I'm going to try to present some of the empirical evidence, and it will be sparse and patchy, as you may see that, but whatever we have at the moment. But what this is the way forward, and we have to have more information on these pathways of impact of climate change. So moving on, so floods and super floods, came in the last. It was there in 2010, but it was also there in 2022. 33 million people got affected, as you know. We know 30 people died. More than 8 million people were displaced. The economic estimates, losses of economic estimates were the World Bank and said 16.2 billion people were actually, in USDs, US dollars, was the loss because of this, and mainly agriculture and housing, and transport and communication. These were the losses besides the deaths which we had. The first line of defense for any such extreme weather events like floods or heat waves or a cyclone, etc., is the health sector. But the health sector usually gets impacted also simultaneously when you have such extreme events. Like this is the civil hospital in one of the district and District Badin in the province of Sindh. So then your health is further compromised if the health, you cannot actually seek healthcare. And other sectors besides health sector, so your education and other institution and economy get disturbed because of this standing waters in one of the districts, which actually was there for several months. Even in some of the places, even if you go there, some of the places you still see some of the water standing. So heat wave is another, every other year we have increasing heat days, and more heat days are occurring. And we are in the process of analyzing this data to get to this information. The last 50 years data is available, which we want to plot for Karachi. But this incident of heat wave occurred in 2015, between 17th to 24th of June, where southern Pakistan, including Sindh and Karachi, was severely affected. And you can see the temperatures were on the 20th June, which was the peak of the heat wave, from 44 to 49, and like 120 degrees Fahrenheit, which is that high. And there was mortality, about 2,000 plus people, which were very much underreported, I would say. People died because of that. We don't have any, good information about how these cities, particularly Karachi, Lahore, and big cities, because these are heat island, this become heat island, how those are impacted and how those are impacted currently as well as in the future. But this heat map I found which was developed and published in International Journal of Climatology 2020, showed that how Pakistan will be impacted by the heat by the end of the century 2100. And there are two pathways in this. If you're aware of this, these pathways, these are called representative concentration pathways. And these are different scenarios which has been actually created or suggested by the International Panel for Climate Change. And the lowest is lowest impact is of 1.9 to highest impact is something like 9.2. So if business as usual or nothing is done, for example, then the RCP 8.5 will be is expected. If something is done and some control measures which are actually agreed in 2015 Paris Agreement, then probably the upper pathway, which is RCP 45, will occur. So those are the scenarios but both are actually very not very encouraging, as you can see. So we need to do something about this and make adaptation measures as soon as possible. So, these are the direct impact, which are very apparent, and you can make connections with the climate change. But these direct impacts are the tip of the iceberg, I consider. Because climate change is affecting every common pathway for disease development and pushes the normal pathway and risk factors and exacerbate the risk factors. And that way leads to increase in incidence and distribution of the diseases. For example, the flood and the water cycle gets impacted if you have more water contamination, and then you have more diarrhea, for example. Those are the normal pathways, but you had dengue, you had malaria, but there'll be more malaria because of the standing water and all that. So those are the common pathways are actually enhanced or gets expedited in some sense. So these indirect pathways are less studied, but some of this, like dengue, malaria, is quite commonly studied in many countries. But how it is impacting the agriculture, how it is impacting the nutrition, how it is impacting the underlying mechanism of disease development, cardiovascular disease, and how it is impacting the birth rate, for example, or the newborn during pregnancy. So all those impact is still to be. We have to get the empirical evidence. Some of those evidence I will share what we have. So coming to the first thing, which is the air pollution. So burning, whether in the kitchen or in the industries or in the vehicles, leads to some kind of emissions. And that is the main issue. The fossil fuel, the biomass fuel are the main drivers, as we know, for carbon dioxide, but it also emits a lot of air pollutants. And nearer you are, like in the kitchen, although the emissions are low, but the exposures are high because of the high concentrations. But in ambient air, obviously, the amount of burning is high. Industry, the amount of burning is high, but it gets diluted, and that's how the impact or the exposure may be less intense in that sense. You are aware probably of this particulate matter, and this is a standard air pollutant which are measured across the globe for looking at the health impact of various sizes over time have been studied, but the recent focus is on particulate matter of 2.5 microns and less because of their higher health impact. Because of the smaller size, they go deeper into the body and circulate in all the body, and can cause anything from stroke to low birth rate to cardiovascular disease. Besides the respiratory problem, we can link it with. So we had some measurements, and we also have some measurements from on ground monitor from Karachi, which shows a very, very high levels like 200 to 300 micrograms per meter cube. And you see the green line below is the standard. Even that standard was actually reduced. This was for 24-hour. I mean, this is 15 microgram now. It was 25 at some point in time. So you can see that none of the days are below the, within the guideline values, and all the days are very high to very, extremely high. And why I'm putting this here, so, and then you have health impact, there are time series studies. So as you have more pollution, there'll be 20, if you have like 51 to 100 microgram, there'll be 20% increase in admissions. And if you have like 100 to 150, 30% increase and so on. So these kind of time series studies are available globally, and this one was conducted in Karachi, Pakistan also. And we have several of these studies which we conducted a few years ago. But also we conducted a study on source apportionment, like what are the major source which are contributing to the particulate matter 2.5. And you can see the oil combustion and urban dust and vehicular emission and sea, all of those actually contribute to that. And this is important for developing interventions. But this we already knew, and this we already know from the global data as well. What is happening? This climate change. So these emissions, besides greenhouse gases, the other gas, the particulate matter, are actually emitted. They are interacting with climate variables like temperature, humidity, precipitation, and this interaction of greenhouse gases and the temperature increase and precipitation actually in a complex manner, increasing the ozone, increasing the distribution of particulate matter, and increasing the volatile organic compounds in the atmosphere. And that chemistry changes and becomes more intense, and then you have impact on the flora and fauna, the human health, as well as the plant health and other buildings and other, it will decrease the crop yield. Besides, you have respiratory, cardiovascular, premature deaths. So that, why I'm putting again on this, this is the interaction and how this climate change is influencing the air pollution and how much intensification it is bringing. That is a difficult thing to measure. And that's where we want to do these kind of studies in order to determine the impact of climate change in the longer term. It cannot be determined in a 1 year or 2 year or 3 year study. So one, attempt we did, Lahore, looking at Lahore city, is longitudinal modeling we did using geographical and temporal weighted regression model. So geographical, models have been there since long period of time, but also including the temporality, how this, the air pollution has developed over time in a particular location, in a particular geography. So there's a new technique which is called GTWR, Geographical and Temporal Weighted Regression, which is developed more recently, like 2013 or 14. So we are using that. It is still a work in progress. But what we found from 1998 onwards, data to 2020, is there is a clear rise of particulate matter in Lahore, and from somewhere around 65 to somewhere around 85 to 90 micrograms per meter cube, which is very, very high. And this is the same data just plotted on a map, and you can see the recent years, 2016, 17, 18, 19, those are very looted and very high levels of sea. So we use the socioeconomic variables and we use climate variables. Climate variables is temperature, relative humidity, wind speed, and precipitation, and socioeconomic variables like population density, land use, and gross domestic product, GDP. So combining all of that, we determined as what are the locations over the period of time which are more impacted and what are the impacts. And this is how the GTWR giving us more special, in terms of space as well as time, information as where these particulate matter are generated and how it might be potentially impacting the human health. And that may lead to some of the interventions which we can at the city level, for example. Similar model for land use, and again, it gives the same information more or less, which areas are more important and which areas are greener, have less, impacted, and road density, where it is impacting compared to some of the other areas. We are developing similar model for the climate variables. As you can see, this is quite tedious process getting all this data streamlined, but hopefully we'll get to there. But the correlation at the moment of the 18 years or 20 years data we have, it shows that wind speed is negatively impacted, which is expected. That if the wind is increased, if we have higher wind, the particulate matter will flush out. If you have low wind, then it will concentrate. So that's not a big finding, but we want to do it as geospatial, geotemporal locations to find out what is causing it. One of the blame all the time is coming from India and coming from the other side. So those are the answers we're trying to get to as whether it is correct or not. So moving on, this study I'm sharing, this was conducted in South Asia, India, Pakistan, and Bangladesh data, and it shows that each 10 microgram increase in particulate matter lead to 3% increase in pregnancy losses, which is an environmental health issues, which we knew. But what is the climate change research questions which we need to explore? So how rising temperature and precipitation and wind speed, etc., might influence the particulate matter, and how in the longer term this might influence the pregnancy outcome. So that is a difficulty which we have to deal with, but probably we'll get to there. One of the favorable or good news, I would say, that the climate data and the air pollution data is now globally available, which you can download and you can utilize that for research easily. When you have to learn the techniques to download and utilize those data, but it's available for each city and each area, whatever you want. We have estimated based on the exposure response curve we have from the studies that children born in Lahore losing average 5 years of life due to air pollution, which is very sad. Moving on, this is Empress Market, Karachi, very busy, a lot of air pollution. And this is the same Empress Market during COVID. So you can see what a clean environment it is. And we looked at some of the data, and suddenly you see in Karachi, Lahore, Islamabad, and Peshawar, all the data suggested when there was a lockdown. There's a dotted line, which is a vertical dotted line, shows that. So there was a decline in the PM 2.5 concentration during COVID lockdown. But the levels still were like around 100, if you see in most of the cities, around 100. That means there are other factors besides. So big industries and vehicles were not operating during that time, but there were small industries or small businesses and household energy being burned. So that is still was causing quite a lot of pollution. And that's where we need to be more, we need to develop intervention, not just in the big industries and vehicles, but also think about residential emissions as well, generators and other things which are causing a lot of emission in these cities. So it gave some opportunity for us to think about more. Now coming to moving my gears towards water pollution. I talked about quite a lot on air pollution, Karachi air pollution, and Lahore air pollution, and how it might be impacted by the climate change, and COVID examples, and Lahore fog, which we are trying to investigate a little more, and probably in a month's time or 2 months' time, we'll have more data to have some explanation of what is happening there. This graph is about water availability in Pakistan. Water per capita available for has decreased over time, as you can see, from 1951 to 2020. So we have become more or less water scarce country, where water per capita is below 1,000 cubic meters. And it is because of the mismanagement of water as well as increase in population. That's given. So if you'll have less water, you cannot talk about the quality of water. So when there will be enough quantity of water, then you can talk about the quality of water. So quantity and quality go together. First is the quantity and then the quality. But even if looking at the concerns of quality, the biological contaminants and nitrates and pesticides, arsenic, fluoride, and sea intrusion, all of those evidences are there for Pakistan. So this is Karachi data, and I mean, I've seen this data for over many years. Pakistan Council for Research and Water Resources keep on showing this data. Then 80%, 90% of most of the drinking water sources are contaminated, and contaminated with microbiological, like 88%, and chemical, like 9%, physical parameters like 18%. So this is similar data, which is more or less across the country, with some less or more figures. But this is huge if you're talking about. So microbiological contamination is a major issue. How climate change actually impact that? So obviously the distribution of contaminated water, the increase in standing water, and all the contaminant we talked about, like fluoride and arsenic and other sea intrusion. So the distribution of these actually increases or goes to places where you don't find arsenic, you don't find fluoride, for example, or you don't have agricultural land, but pesticides are taken, are distributed to those other areas where flood water is actually distributed those hazards. So climate actually just exacerbates and redistributes or further distributes and contaminates more water, which may be considered safe, or more geographic areas which may be considered safe in Pakistan. I'll give you an example of arsenic. We did some investigation on arsenic. Arsenic is in underground water. When you drink it for a long period of time, it can cause cancers and other, but it also lead to some skin problems, which are called symmetrical hyperkeratosis, or hardening of symmetrical palms and soles. This is typical. And this is a huge problem along the Ganges River in India and Bangladesh, but it also is present to some extent along Indus. We did an investigation where we actually tested drinking water, underground water sources along the Indus, And you can see the blue dots and the red dots. The red dots have higher arsenic above the permissible limit, which is 10 microgram per liter. And those red dots are mostly along the Indus. So what it shows is there's a higher concentration of arsenic along the river. And that's the same pattern we see along the Ganges. And we also saw these, these skin lesions more commonly along the Indus River. What climate change can do, and we don't have the data, we need to do a longer term analysis, is how the floods and underground water table actually leading to redistribution of these hazards to a more or definitely a wider geographic area. Now, coming to the last part of my presentation, so I've talked about water in the second part, where I discuss, the major concern is biological and chemical, and how the climate change might be influencing the distribution of those chemicals to a more, safer areas and non-contaminated areas. You might be aware, this is the third part of my presentation, you might be aware about this nationally determined contribution. The nationally determined contribution, NDCs, are actually are pledges which are made by each of the country to the International Panel for Climate Change at the Communities of Parties or COP meetings, which happens every year. The last one happened in 27th meeting happened recently. So based on, every country has to say or give a document or a commitment to the IPCC that what are they going to do in next 5 years. So this every 5 years updated. So this is the second one. So it was updated 2021 for Pakistan. So what Pakistan has pledged is that they will have a reduction of projected emission by 2030, 50% reduction. And how they'll do it? So the Pakistan emission at the moment, like 490 millitons carbon dioxide equivalent of 2018, which is not very high compared to many other countries. It's 0.5% of the total global emission. But of the 50% reduction, they said 15% unconditional, 35% conditional. That means 15% out of pocket from the finances by Pakistan and 35% depending on if they receive the finances from the developed countries. And these are the high priority actions: mitigation and adaptation, renewable energy and electrical vehicles, and continued investment in nature-based solutions, and moratorium on the new coal power plants. Older power plants will keep on working, and Indus Basin flood risk mitigation, and enhancing the protected water cover from 12 to 15%. I don't know how much this has actually deviated, or because of the recent last year, the plans, all the government plans are actually not working at the moment, as you can imagine. But these are the plans, or these are the pledges we made. Based on that, this study, one study, as I talked about, we conducted in Pakistan about health benefits and health benefit or co-benefits actually. So if you intervene for climate change, there are benefits for health as well. So it's a win-win situation. So this study was conducted in Pakistan. If we remove fossil fuel subsidy, by the way, fossil fuel subsidy has been removed. We hear all the time that the subsidy has been removed, and more, the prices has been raised quite a lot in recent time. So what will happen if the subsidy is removed? Then people will use less or use more carefully the fossil fuel, whenever they require, so more cautiously. So fossil fuel is primary source of carbon dioxide and also for the air pollution. So lower greenhouse gases if you're burning less, and it also lowers air pollution. That's the logic of doing this study. And evidence has showed that removing fossil fuel subsidies has led to COVID-19 economic recovery in India and increased funding for ministries to spend on human and economic development program. Because if you're not spending on fossil fuel, then you can spend on other human and economic development programs. And it reduces poverty. So these are the evidence, recent evidence from this. So based on that, so average percentage carbon dioxide emission reduction model across 26 countries, like if you remove subsidies for fossil fuel and you invest the 10% of the saving in renewable energy and you invest 20% of the saving in energy efficiency and introduce 10% energy tax. So all of that actually lead to savings, and subsidy savings and reallocations lead to emission reduction, as well as it produces some reduction in air pollution as well. So the purpose of this study was to estimate health benefit or removal of fossil fuel subsidies under different ambition scenarios and compared it with the nationally determined contribution reference NDC reference case of 2020, which was already pledged, and determine the health benefit of reallocating the saved subsidies in health and social welfare. So these were the references, which are NDC reference case and business as usual, BAU, and current ambition and high ambition. So in different scenarios were built for renewable energy, energy efficiency, and a share of new electrical vehicle, etc. And based on and the fuel grade also from Euro 2 to Euro 5. Based on these assumptions, if we do that, so what happens is business as usual versus current ambition versus high ambition. So you can save in high ambition, for example, avoid premature deaths among adults, how many deaths in infants, how many pregnancy losses you can avoid, and what are the economic benefits in terms of millions of dollars. So those were converted into total DALYs, and you can see the substantial gain from reducing the fuel subsidies. So this study actually gave the government some way forward as what can be done. And these kind of health co-benefit studies are for more such co-benefit studies are needed to actually make an economic case for climate intervention. Because one of the major challenges of climate change is how we'll have these 100 billion USD every year to make that happen. So some of the recommendations which came from this study was for government of Pakistan could reduce 27.5% of greenhouse gas emission by 2030 and prevent 65,000 annual deaths from air pollution. So these are, and then we had recommendation that if you increase renewable energy generation up to how much you can reduce by up to 70%, 75% by 2030, and increase energy efficiency and transition to biomass to electricity, increase share of electrical vehicle, and fully phase out fossil fuel subsidies, introduce 10% fossil fuel tax, reinvest revenues in health. So these are the policy recommendations, but also there were health recommendations, which comes out from this, that to put health at the center of Pakistan nationally determined contribution, which is not at the moment. They're looking at just energy. Adopt a health in all policies approach to energy policies and establish mechanism to facilitate collaboration between health and energy professionals so that they can talk to each other as how it is benefiting each of the sectors, and continue to obtain reliable data on health co-benefits, climate ambition in Pakistan to inform policy. So data is a problem. So this study is available on the net, but you can read more. I've just quickly gone through that. There are methodology in this which you can read and also adopt adapt it for other countries as well. So in the end, I'll just stop on this slide and say that direct health effects of climate change is quite known and noticed, but it's tip of the iceberg. It's the indirect health effects which we want to measure more clearly and want to know how, and they are complex and less known. And we need to do further studies on that and also simultaneously work out a solution. And these are more complex. So thank you. I hope I've saved some time for you to have some questions as well.
Well, thank you so much, Dr. Zafar, for a fabulous presentation. It was very informative and I must say very eye-opening as well. We will take any questions. If you guys have any questions, please put them in the Q&A section at the bottom of your screens and then we can go through them. I guess we will give everyone a couple of minutes to write the questions in the chat box. Okay, looks like we have one. Dr. Irvin is saying, can you talk about the work of the Ministry of Climate Change in Pakistan?
Okay. So, yeah, thank you, Paul. Thank you, first of all, attending the seminar, listening to this presentation. Yes, Ministry of Climate Change exists in Pakistan, the national ministry, which works for overall, at the national level. But now, since the 18th Amendment, so that's the 18th Amendment where provinces were made independent. So we have provincial entities also. So we have Ministry of Climate Change and Sindh and Balochistan and Punjab and everywhere else. They have, they have developed national climate change policy that is available, and they have this NDC, like nationally determined contributions, NDC. They have revised in 2021, so those documents are available. What they haven't done is the National Adaptation Plan. So for Pakistan, it is important. I mean, mitigation is one thing, but mitigation has health co-benefit and co-benefits which you can talk about, and we can invest on that. But Pakistan's contribution to global climate change, emission is just 0.5%, as I said. But their ranking in vulnerability for climate change is, I think it's fifth globally. So they are very vulnerable to the impact of climate change. And that's why adaptation is the key. And there are, I know, there are 42 developing or low LMICs, or low and middle income countries, which have developed national adaptation plan. Pakistan don't have one. They are still in the process of developing a national adaptation plan, because that's essential. We have the policy, but we don't have a plan in place. And I think they keep on saying that they are moving in that direction, but it's still someone said that we are somehow graveyard of policies, but there are no plans and programs. I think we need to push towards plans and programs. And that's where they're lacking.
That's right. Thank you very much. Do we have any more questions?
So there's an anonymous attendee. It says, could you please elaborate more on the most common indirect health effects of climate change, particularly when it comes to maternal and child health? So, if I take the three pathways, for example, how the climate change impacting the biological cycle, and how it is affecting the physical parameters, how it is affecting the ecosystem overall. So these are the three major pathways we can. So there are evidence that this Vibrio cholera is more commonly available, more widely and geographically available because of the increase in temperature, and seas in the north where it was not available. So this is just one indication. Obviously, all the other viruses and bacteria, which is temperature dependent, are actually, you can say, multiplying more readily and increasing and thriving in areas where they were not thriving before. So that's a big threat, and you will see emerging, re-emerging infections, and which is COVID might be one example. And so that's one pathway. The other pathway is the physical parameters, so air pollution and water pollution we talked about, and how it is impacting. We need to learn a lot of things within that, and how each of those parameters are in fact impacted, how the ozone is produced, and how much, and what conditions, what combination of factors leads to its production, the volatile organic compounds and all this. So again, that's another pathway. And the water cycle, how the water cycle gets affected, as we know that because of the increased precipitation and erratic precipitation, sometimes you have more water, sometimes you don't have water at all. So availability of water has become a major issue, which impacts agriculture, which impacts nutrition, which impact food security. So all those, there's a big nexus between agriculture, water, and food and nutrition, all interlinked, and certainly with health. So those needs to be looked at as an indirect pathway. The third thing is about the ecosystem itself. So how it is impacting the biodiversity of the plants and animals, and in the longer run, how it impacts the overall health. So those are the three things I can just tell. Are there any other questions? Yeah. So I just saw 3 questions. Are there any other, Deba, you can see any other question?
Yes, sorry, I was muted. So there's one that says, can you please comment about the impact of climate change on health of different working populations in Pakistan?
Okay. So, so this is Asad Nafis. Okay, thank you, Asad, for throwing that question. I will throw that question back to you also. So you're the occupational health specialist. Yeah. Thank you for raising. So I think we know, we have done some, a smaller study, I would say, and I haven't shared that. But this e-hailing riders, the riders on the motorcycle, you can say, who are actually e-commerce is increasing globally, as in Pakistan. So there are websites like Food Panda. There are other riders riding for delivering services. Even the vegetables and things like groceries are at the doorstep. So these riders are actually on the bike, and they work during the day and during the night, extreme weather, irrespective. And for some of the hard hours or hot days or heating hours, like 10 to 4, during that day they are paid little more, 10 rupees more, 50 rupees more for every delivery, and they become more vulnerable. So we had this discussion with the rickshaw driver, the vendors, as well as these Food Panda and Bikeas and other, those who take transport people from one place to another. So all of them actually have reduced some time. Their productive time has reduced in the summer. So, and we are still calculating as how much, but I'm assuming, you know, about half an hour of work on an average has been lost for each of these workers during summer. And that's a big loss. And if you count this for the same for the agriculture workers, for the construction workers, for people like us who are working and not working in air conditioners, for example, and working outdoor workers particularly. So their output and productivity is going down. And that's the global data is available. Lancet Countdown talks about that. So agriculture workers are most which are impacted. Industrial workers are the second one. For Pakistan, obviously, agriculture worker and construction workers are the two most important ones, and the outdoor workers and these new e-commerce workers are severely impacted, and their productivity is influenced. So, yeah. And I mean, we're not talking about the health impact and other impacts. Obviously, those are there as well, but certainly the productivity and indirect impacts.
All right, well, thank you very much. I do not see any more questions. I would just like to thank you for giving us your time and for this very interesting presentation. I would also like to thank the Office of Public Health Practice for co-sponsoring this event with the Sparkman Center. And well, Anna has a question. Dr. Hilova, who works for the Sparkman Center, she says, what would you like to recommend to our UAB students who would like to get involved or focus on climate change issues in the future?
Yeah, that's a good question. I think I alluded to during my speech as well, but I would just lay it down again. So some of those impacts, like direct impacts, are more apparent and you can do it easily, more readily. But some of the indirect impacts, like how climate change influence air pollution and air pollution impacting, um, you know, the health, is less known, and it requires expertise and skills and the availability, first of all, availability of data for longer term. The good thing about is that you have now several data sets available for climate for last 50 years or 60 years for the entire globe. And that you need to get a hand on. You need to learn as how to download and how to analyze. First of all, these are good data sets available, which were not available before 2010 or 2012. And we were thinking how to conduct long-term impact of climate change on human health, but those are now available. And we have a lot of information on the global scale. So IPCC is doing all kind of analysis at the global scale and impact at the global level of temperature and humidity and etc. But the information at the local scale, like the city scale, and the information at the country level or sub-district or sub-country level are not available. Because when you want to sensitize the policymakers at the country level, you need to have information at the country level as well. And that information analysis, the same analysis which is available at the global level, is not available at the country level. The challenge is one, obviously, it becomes a smaller scale. And also the challenge in LMIC countries, like we face that the health data is not very well organized and available. But for the UAB people, I assume that you have, better organized health data, national data and country level, or state level data. More organized data is available, and that's the opportunity that you can do such kind of analysis to have more local information, how the heat is impacting for Alabama, how it is impacting northern part of the United States versus southern part of the United States, for example, Georgia and Florida. Those information is important. for national adaptation plan and mitigation efforts. So I think I say that it's localization of the global climate change. So you need to produce the local information which is available at the global scale. When it is available at the global scale, oh, heat days are increasing, oh, precipitation are increasing, oh, floods are increasing. But where? If it is in Pakistan, then it matters. Unfortunately, the climate has no boundaries, and the countries have boundaries, and that's where they think within the boundaries, and you need to produce the data within the boundaries in order to sensitize them.
Right. Well, thank you very much. Looks like we do not have any more questions, and our time is up. So thank you very much again. And I would like to thank all the participants for joining in today. Those who were not able to join in today, this will be recorded and sent to them. So I hope everyone has a great day. Thank you very much, Dr. Zafar.
Thank you, Teba, for facilitating that. Thank you, everyone, for listening to this presentation. If you have any further questions, please do interact. Write to me. My email is zafar.fatmi, zafar.fatmi@akuaghanuniversity.edu. So you're welcome to write to me if you have any further clarification questions. Thank you so much.
Okay, perfect. Thank you so much. If you have any more things or questions for you, we'll definitely direct them to you.
Thank you.
Thank you very much. Bye.
Bye.